I talked about a really exciting topic to me, and that's metastatic HER2 positive breast cancer. And I started out with the data from the CLEOPATRA study, which I think is very fitting to be here in Egypt. Cleopatra VII was a ruler about 2,000 years ago here. And the CLEOPATRA study final survival data that I presented at ASCO showed that 37% of the patients were still alive at 8 years. And this is with metastatic HER2 positive breast cancer. And also that 16% of those patients had not progressed on their trastuzumab, pertuzumab, and chemotherapy. So that was very exciting. And then I presented the data from San Antonio Breast Cancer Symposium that was last month, which really was pretty profound. There's a new agent that has the trade name HER2, which was just approved in the US on December 20th. And the data was presented from their Destiny-1 study, showing about a 60% response rate with almost no patients having progressive disease. So it was really exciting to see that data. Unfortunately, there was toxicity with it in that they had 4 cases of fatal lung toxicity, ILD. And I think, my view of that, and I said that in the meeting, is that this agent is so active that we will eventually figure out how to deal with the lung toxicity. For example, pick it up sooner, give the high-dose steroids sooner, and hopefully we'll not see this kind of toxicity in the future. So that drug is, as I said, called HER2 is the trade name, and it's trastuzumab deruxtecan, which is a long name. The other really exciting data that was presented at San Antonio that I talked about was in one of our biggest unmet needs, and that's with CNS metastases. And we know that the patients do very well in all this HER2 targeted therapy, but a third to half of them develop brain metastases. So a new tyrosine kinase inhibitor called tucatinib was presented in the HER2 CLIMB study. And in this treatment, these patients had had all the previous anti-HER2 therapy that's very effective, trastuzumab, pertuzumab, T-DM1, and they'd had a taxane. And the response rate, or the progression-free survival, was significantly improved over the group of patients who got the placebo. So that is very exciting, and it was also very significant in those patients who had brain metastasis when they were put on the study. So that drug, I think, will probably be approved in the US sometime in the near future and will really be a great addition because it's an oral therapy. It will help with our unmet need of CNS mets. And also, the toxicity that we're seeing with that drug is diarrhea, so that is another toxicity that needs to be worked on. I think that it's only getting better and better for patients with HER2 positive metastatic breast cancer. And you can see it. I actually just looked up in clinicaltrials.gov, and there's about 1,000 clinical trials in HER2 positive breast cancer because the therapies have been so effective, but not 100%. So people are working more and more to try to not make incremental benefits, but actually cure the disease. So I think it's really just going to keep getting better and better for these patients. We're also defining groups that don't do as well, like those patients whose tumors have the PIK3CA mutation, they don't do as well. So there's new drugs like alpelisib, which is approved for ER-positive disease, that's being tested in HER2 positive disease to see if it could help that group of patients who doesn't do as well. I just think it's a great time for patients, and the other aspect too is some of the data that has been presented at San Antonio looked at the sub-Q dosing of pertuzumab and trastuzumab, so that'll really help patients too, in that they don't need to have a port. They can get this done very easily. They don't have to have IV anymore. So I think that was a great quality of life study that was presented, and I look forward to using that for patients.